Effective medications for improving ejection fraction, EF, in heart failure, updated for 2025 consensus. Hello, and welcome to this guide on your treatment plan for heart failure. Receiving this diagnosis can be confusing, but the medical community has made incredible advances. Your diagnosis, HFrEF, simply means your heart muscle is weakened and is pumping blood with less force than normal. This force is measured by your ejection fraction, or EF, and a number of 40% or less indicates HFrEF. We are going to walk through the proven, powerful medicines that will help your heart muscle heal and grow stronger. To visualize your EF, imagine your heart's main pumping chamber, the left ventricle, is filled with a cup of blood. If your heart squeezes out half that cup, your EF is 50%. If your heart is only squeezing out a quarter of that cup, your EF is 25%. Our entire treatment plan is aimed at healing the damaged muscle, making the chamber smaller and stronger, which in turn increases the amount of blood pumped out. We call this reverse cardiac remodeling. This healing process is how we aim to increase your EF. When your heart weakens, your body's emergency systems kick in. It releases powerful stress hormones, like adrenaline, which tell your heart to beat faster and your blood vessels to tighten up. While this helps for a moment, keeping your heart constantly flooded with high levels of these hormones is actually toxic. Over time, these chemicals cause harmful effects. They speed up scarring, make the muscle rigid, and continue to drag your EF down. Our 4 main medicines are designed to stop this toxic cycle dead in its tracks. The cornerstone of modern heart failure treatment is using a specific combination of 4 drug classes, referred to as the 4 pillars or Guideline-Directed Medical Therapy, GDMT. No single drug can stop the damage completely. The survival and EF benefits come from the synergy of these 4 pills working together. Each one interrupts a different part of the toxic stress cycle we just discussed, providing complete protection and maximizing your heart's healing potential. We start all 4 as quickly as possible. You will notice that most of your new medications start at a very low dose. This is intentional and medically necessary. The process of gradually increasing the dose is called titration. We need to move slowly, typically doubling the dose every 2 to 4 weeks, to give your body time to adjust, especially to the effects on your blood pressure. The ultimate goal is to reach the target dose, the dose proven in clinical trials to provide the maximum possible benefit for your EF and survival. Please be patient, as this process takes time, but it is critical to your long-term success. The first pillar is the ARNI, or Entresto, and it's a true powerhouse because it does 2 jobs at once. The first part, valsartan, blocks the main part of the renin-angiotensin stress system, reducing the toxic pressure on your heart. The second part, sacubitril, is the game changer. It stops your body from destroying its natural, protective healing hormones. By simultaneously blocking the bad and boosting the good, the ARNI provides the strongest signal for reverse remodeling and EF recovery. The second pillar, the beta blocker, gives your heart a crucial break. High adrenaline levels force your heart to work too hard. The beta blocker blocks those signals, slowing the heart down and reducing its overall workload. This allows the heart muscle to relax, heal, and structurally repair itself over time. For this benefit to work, you must be on one of the 3 specific beta blockers proven in clinical trials, and we must successfully titrate the dose to the proven therapeutic level. The third pillar is the MRA, or mineralocorticoid receptor antagonist. This drug targets a different stress hormone called aldosterone, which is responsible for promoting internal inflammation and the formation of hard, non-stretching scar tissue, fibrosis, in the heart muscle. By blocking aldosterone, the MRA ensures that the improvements gained from the other drugs are sustained, preventing your heart from becoming stiff, and maximizing the durability of your EF recovery. We closely monitor your potassium and kidney function while you are on this medication. Our fourth pillar, the SGLT2 inhibitor, is a relatively new but now mandatory treatment. It works through two mechanisms. First, it signals your kidneys to slightly excrete more salt and water, which reduces the overall pressure and fluid strain on your heart immediately. Second, and perhaps more importantly, it helps the heart muscle switch to a more efficient type of fuel, improving cellular energy and directly protecting the muscle from strain. The great news here is that these drugs provide immediate benefit and do not require dose titration. You start and stay on the 10 mg dose. There is often confusion about statins. If your heart failure was caused by clogged arteries, that is, cholesterol blockage, you must take a statin. However, we need to be clear, studies consistently show that statins, by themselves, do not reliably make a weakened heart pump better. Their purpose is purely to lower your cholesterol to prevent a second heart attack or stroke, which could severely worsen your existing heart failure. Think of them as necessary life insurance against a future cardiac event. Since the goal of statins is maximum protection from future blockages, we prescribe high doses. This is called high-intensity statin therapy. This means we aim for doses like atorvastatin 80 mg or rosuvastatin 40 mg daily. We will start lower and move up to the dose that your body can handle. If you experience muscle pain or other side effects, please tell us immediately so we can adjust the dose while maintaining the highest possible level of prevention. While the ARNI is the preferred first pillar, a small number of patients experience a severe allergic-type reaction called angioedema, dangerous swelling of the lips, tongue, or throat. If you have ever had this with an ACE inhibitor or experience it with the ARNI, we must stop the drug immediately. We will then substitute it with the next best alternative, such as an angiotensin receptor blocker like losartan. We never leave a gap in your treatment. We simply switch the drug class to maintain the full protection of the four pillars. The combination of hydralazine and isosorbide dinitrate, HSDN, is a valuable backup therapy. Instead of blocking hormones, this combination works as a direct vasodilator. It forcefully opens up blood vessels. This dramatically reduces the workload on the heart. It is the best choice if you cannot tolerate the ARNI. It is also required as an add-on for African American patients who remain symptomatic, based on the results of the HFT trial, as it provides an additional survival benefit in that group. You are the most important member of your care team. Your role in the healing process is simple but crucial: consistency. You must take all four of your pillar medications every single day. Do not stop or lower your dose without talking to us first. Be patient during the titration phase, as it is a necessary step to reach the proven EF improving dose. Finally, maintain open communication with your doctor and pharmacist. Report any side effects, like persistent dizziness or unusual swelling, so we can adjust your plan safely and effectively. To summarize, your journey to a stronger heart is built upon the four pillars of modern medicine. These drugs work together to reverse damage, reduce scarring, and boost your heart's healing power. Remember that consistency, taking all four medications exactly as prescribed every day, is the key to achieving the maximum benefit and increasing your ejection fraction. Continue to follow your titration schedule closely and attend all scheduled lab tests and checkups with your healthcare provider. Thank you for taking the time to understand your treatment plan. References.